Welcome to the latest edition of Hematology Updates, covering breakthroughs in the past 2 weeks. Brought to you by LucidQuest. Sarclisa subcutaneous formulation is moving closer to expanded use in Europe, following a positive opinion from the CHMP. The therapy, delivered via on-body injector or manual injection, demonstrated comparable efficacy, pharmacokinetics, and safety to intravenous administration across multiple myeloma settings, including both relapsed or refractory and newly diagnosed patients. DARZALEX has received a significant label update in Europe, enabling patient or caregiver administration of its subcutaneous formulation from the 5th dose onward. This decision, following appropriate healthcare professional assessment and training, marks the first oncology injectable approved for self-administration in Europe and may improve treatment convenience and adherence. Otsuka has submitted a supplemental application in Japan to expand the indication of Iclusig to include first-line treatment for adult patients with Philadelphia chromosome-positive acute lymphoblastic leukemia. The application also includes a new 10 mg tablet formulation, potentially broadening its use beyond current indications. HYMPAVZI is approaching a label expansion in Europe after a positive CHMP opinion supporting its use in hemophilia A or B patients with inhibitors aged 12 years and older and weighing at least 35 kilograms. The decision is based on phase 3 data comparing weekly prophylactic treatment to prior on-demand therapies. Bristol Myers Squibb has expanded its standing in the Gaap initiative, marking 10 years of efforts to address disparities in multiple myeloma care. The program now includes broader research, education, and community engagement, supported by a U.S. survey of more than 1,000 patients, caregivers, and providers. CB011, an allogeneic anti-BCMA CAR-T therapy, has received RMAT designation from the FDA for relapsed or refractory multiple myeloma. The designation reflects early clinical activity and manageable safety observed in the phase 1 study and may support accelerated development pathways. Mitapivat is advancing toward a potential accelerated approval pathway in sickle cell disease. Following discussions with the FDA, Agios plans to submit a supplemental application in the coming months, supported by Phase 2 and Phase 3 data from the RISE UP program. The American Society of Hematology has issued new clinical guidance for severe acquired aplastic anemia. The recommendations cover diagnosis and management across pediatric and adult populations, including treatment selection, use of L-Thrombopag, and strategies for relapse or non-response. Stay ahead in hematology research. Like, share, and subscribe for our updates. Visit www.lqventures.com or email us at info@lqventures.com for expert healthcare consulting. See you next time.